Hi everyone! Almost everyone has experienced a headache at some point in their life. Whether it's that familiar throb, a tight pressure across your forehead, or that devastating pain behind one eye, headaches are as universal as they are misunderstood. For some, it's just an occasional annoyance. But for others, it's a chronic condition that disrupts work, sleep, and even mental health. Too often, people dismiss them as trivial or self-medicate without a real diagnosis. But here's the truth. Understanding your headache is the foundation of effective care. Today, we're going beyond the pain to help you understand what's really happening and how to take control of your health toolkit. What is a headache really? Here's a fun fact to start. Your brain itself cannot feel pain because it has no pain receptors. So, what are you feeling? The pain actually comes from surrounding structures like blood vessels, muscles in your neck and scalp, and the protective membranes around the brain called meninges. Doctors classify headaches into two big groups. Primary headaches. These aren't caused by another disease. The headache is the condition, like migraines or tension headaches. Secondary headaches. These are symptoms of something else, like an infection, injury, or even high blood pressure. While less common, these can be serious, so identifying them is crucial. The big three: tension, migraine, and cluster. Tension type. This is the everyday ache. It feels like a tight band around your head. It's usually caused by stress, poor posture, or dehydration, and it doesn't usually come with nausea. Migraines. This is a neurological disorder, not just a bad headache. It's often throbbing on one side and comes with sensitivity to light and sound. Some people even get an aura, visual disturbances like flashing lights, before the pain starts. Cluster headaches. These are rare but excruciating. They happen in clusters and cause intense, burning pain around one eye. Unlike migraines, these often make people feel restless. Red flags: when to seek help fast. Most headaches are benign, but some are medical emergencies. We use the acronym SNOOP4 to identify red flags. S is for systemic, like fever or a stiff neck. N is for neurological, confusion, weakness, or vision loss. O is for onset, a thunderclap headache that hits max intensity in seconds, the worst headache of your life. O is for older age, a new type of headache appearing after age 50. P is for pattern change, a headache that steadily worsens instead of resolving. Positional change. Papilledema, the swelling of the optic disc, where the optic nerve enters the eye, caused by increased pressure inside the skull, intracranial pressure. Precipitated by Valsalva. The Valsalva maneuver is the act of attempting to exhale forcefully while keeping your mouth and nose closed, or while bearing down. You do this naturally when you cough or sneeze, strain during a bowel movement, lift a very heavy object, laugh, or cry intensely. If you experience these, don't wait. Seek medical care immediately. Common headache triggers. Triggers are very personal. Common ones include stress and emotional changes, work pressure, anxiety, emotional distress. Sleep disruptions. Too little, too much, or irregular sleep pattern. Hormonal fluctuations, menstruation, ovulation, pregnancy, and menopause. Dietary factors: skipping meals, dehydration, alcohol, especially red wine, caffeine withdrawal, aged cheeses, processed meat. Sensory stimuli: bright or flickering lights, loud noise, strong odors. Weather changes: high temperatures, high humidity, barometric pressure shifts. Medication overuse. Frequent use of pain relievers can paradoxically lead to rebound headaches. Physical exertion. Intense exercise can induce headache in some people. Keeping a detailed headache diary, noting the timing, duration, severity, location, associated symptoms, and potential triggers of each headache is invaluable. It helps both the patient and their doctor identify patterns, confirm diagnoses, and design effective treatment plans. Many people are surprised to discover, after just a few weeks of tracking, that their headaches follow a very predictable and manageable pattern. Management strategies. To manage them, we use two approaches: acute treatment to stop an active headache, like paracetamol for simple or tension headache, or triptans for migraine, and preventive treatment to reduce how often they happen. A quick warning, if you use pain meds more than twice a week, you might get rebound or medication overuse headaches. Your brain becomes sensitized and the cycle continues. If that's you, please talk to your doctor. Established preventive medications include beta blockers such as propranolol and metoprolol, anticonvulsants such as topiramate and sodium valproate, and tricyclic antidepressants such as amitriptyline. Non-pharmacological preventive strategies. Living well with daily habits. Finally, lifestyle is your best defense. Sleep. Consistency is key. Go to bed and wake up at the same time every day. Hydration. Sometimes a glass of water and 20 minutes of rest can abort a mild headache. Stress management. Address the root, not just the symptom. Stress is among the most frequently cited headache triggers. Find a stress management approach that genuinely works for you. For some people, that is daily meditation or yoga. For others, it is regular walks in nature, creative pursuits, social connection, journaling, or structured therapy. Regular meals. Dropping blood sugar is a big trigger for headaches. Eat regular meals at consistent times each day. Also, be mindful of dietary triggers. Exercise. Regular, moderate-intensity aerobic exercise can be as effective as some meds. I highly recommend keeping a headache diary. Finally, do not underestimate the value of connection. Organizations such as the American Migraine Foundation provide reliable patient resources, treatment guides, and directories of specialist headache clinics. You do not have to navigate this alone. Thanks for watching, stay healthy, and I'll see you in the next video.